Good evening. Now it's time to begin the session. Welcome to TICAD 8 side event, NTD malaria control in an area of COVID, sponsored by Nagasaki University, GHIT Fund SDGs, Promise Japan, Malaria, No More Japan, DNDI Japan, Jagantad, AMIC, Nikkei FT, Infectious Disease, Confectionaries.
ジャパン共催。ウィズコロナ時代の NTDs。
Thank you for joining us this seminar.
ヘルスケアインフラの構築を考える。
How we can build the healthcare infra. This is going to be a webinar. Thanks for coming. I am Choma from Nikkei FT Infectious Disease Conference. I facilitate this meeting. Thank you. Nice meeting you. This seminar, simultaneous translation is provided for this seminar. And for each of the audience, if you want to speak up, you have to unmute yourself. Then in order to avoid the confusion, you would have to click the globe icon at the bottom of your screen, then select English or Japanese. Now, before we start, as a representative of this event, I would like to invite President of Nagasaki University. Well, he is going to speak in the video, and after that, I am going to go through the brief explanation about Asia-Africa Medical Information Consortium, AMIC. But first, please watch Mr. President Kohno's video. Good evening. This is Kohno Shigeru speaking, President of Nagasaki University. Welcome to TICAD 8 side events. Today's theme is malaria NTD, which is an endemic disease still rampant in Africa, and the access issue of the healthcare. COVID, which started in 2019, this made us realize how important to control the risk. Especially, we have seen the inequality, disparity in terms of distribution of vaccine distribution, and that made us realize this disparity is there, and without reserve capacity in African nations, malaria NTD so increase from decrease. So for the healthcare issue that the entire world face, what can Japan do? One of the key words to find the answer is to enhance the access for medical treatment. At our university, we take this planetary health. This is as a school curriculum. And then that's how we try to tackle the global issue. Today, I hope all the participants can join us and realize what's really going on in Africa, and become our member to find out the solution. So we have just about 1 hour. Enjoy our discussion. Thank you. Thank you, President Kohno. Now, one of the key themes, NTD malaria. We are trying to come up with the action plan and the voluntary project AMIC, Asia-Africa Academia Information Consortium. Let me introduce them. This consortium is a spin-off of the annual events, a TT Infectious Disease Conference, and through PPP collaboration, they're trying to find a solution, and not just a discussion, but they are trying to find action plan, and through advocates to the government. So at the side event, discussion will take place, and this is going to be the central part for the agenda making for the G7 summit next year in Hiroshima. But this is a good opportunity to think about how we can, Japan, to contribute to the global health and how we collaborate with those players as well as PPP.
In order to open today's session, we will hear from Mr. Kozo Akino from House of Councillors. So, Mr. Akino, could you go ahead? Yes. Good evening, everyone. As mentioned, I am Kozo Akino from House of Councillors. Let me share my screen.
改めまして、ウィズコロナ時代の
So this
NTDs
is NTD and malaria control in the area of with corona, the building of a healthcare infrastructure. This is the event in which I am making a congratulatory speech. NTDs control is very important, and I am helping support this initiative. Regarding this initiative, Ministry of Foreign Affairs and the Ministry of Health and Welfare are working to support funding the ESPEN and other initiatives. And as for me, I come from Nagasaki University. In Kenya, I visited there, and we take countermeasures about different types of diseases. This is a photo that I took, and these are the mites that we took out. And those shoes are now transported. So we are working with Ministry of Foreign Affairs and other ministries through the National Congress deliberations. WHO has already given us the understanding that the issue is included in those diseases. GHIT and other collaborations have already started, and we need to understand this is one of the learnings that is very important. What I'm talking about is a flea, by the way. So in the Kigali Declaration in June, sorry, let me share my screen. In the June's Kigali Declaration, the malaria and NTDs control and eradication is very important. By 2030, 2 NTDs need to be eradicated, and in over 100 countries, 1 NTD will be controlled, and intervention and treatment have to be reduced by 90%. That is a really ambitious target shown. But where should we start, and how should we work on it? Regarding those questions, I would like to hear the guest speakers' presentations so we understand what politicians can do. Malaria's readiness and response needs to be created. So together with the Alliance of Congressmen, we would like to hear from all the professors' presentations so that we can work together as politicians. And Mr. Ezoe from Ministry of Foreign Affairs, and we also have other members from the Ministry of Welfare. So we would like to hear the lectures and discussions, which I will be learning very earnestly. And we would like to once again appreciate your participation today. And congratulations on the opening of this event today. Mr. Akino, thank you so much. So now let's move on to the agenda today. Today's session is largely divided into 2 parts. In part 1, we discuss malaria and NTDs. We will hear presentations from guest speakers, and in part 2, we will have a panel discussion. This is an online seminar, and the time is limited, so we will have a little more strict timekeeping. just to let you know for your understanding and cooperation. So the first presentation is about malaria. As I mentioned, AMIC, Malaria Subcommittee's head, who is Mr. Kiyoshi Kita from Nagasaki University, he is going to talk about the PPP for elimination of malaria in Africa. So Mr. Kita, could you go ahead, please?
はい、すみません。来たんですけど、聞こえますでしょうか。
Good evening to you all. Can you hear me? Yes. Well, I just finished the meeting and came to straight from that meeting. So somehow I made it on time. I am going to share my screen.
画面が見えますでしょうか。
Can you see my screen? Yes. Right, okay. Just one moment, please. I do apologize. Well, time is too important.
ちょっと時間をですね、私、今トーマさんの方から紹介
As introduced by Thomas, a nice introduction. Thank you. I am the chairman of Malaria Consortium. So I like to talk about what we are doing. And after that, Dr. Kaneko and other people can talk about in more detail. So this Malaria Consortium. Okay, we have screen back. Can you hear me? Can you show my screen? Yes, we can. So through this partnership, what we are trying to do is eliminate or control malaria, especially in the African nation. So this consortium started in 2016, and in 2018, they made a proposal to Japanese government, and in 2019, well, they have been doing many things, but today I like to talk about the project Satoshi. Meanwhile, business in Africa, they started doing something for that as well. So I can touch upon that later. So having said that, however, so in 2021, they started this parliamentary group in 2021. So they are doing many things, but in future, they would have to have continuous government support, which is quite essential.
And
how we can prepare for the next pandemic after this. So that would require Japanese contribution or partnership. So that's the two important points. This one is a member of consortium. You can find public entity, governments, academia, NPOs. So many members we have. It's quite from wide area. This one is a speakers list from Nikkei FT Malaria Conference. These are all speakers. You can find Omi, Professor Omi. And then they gave us reports and followed by discussion. As you may know, this consortium is one of the new initiatives by Japan as well. So that would directly connected to SDGs and UHC. So, as you know, malaria elimination is a global challenge. WHO is promoting this, and WHO is saying that by end of 30, 90% reduction of deaths. And the most important things is that endemic in children under 5 years, we have to do something about it, and as well as asymptomatic patients, insecticide resistance, drug resistance, and finance, as well as the health system. All those are key issues. And even if we had good drug, we do not have system to deliver to those who need it. So that's the current situation. And what to do? How we can overcome these challenges? This is that page. That is called Three Arrows Approach. That's from Japanese war warriors. So we have weapons, vaccination, and vector control, and not just one by one. We need to deploy these in combination at once. So that's why we have to enhance the partnership. So this one. Now we have established parliamentary group to end malaria by 2013. Today, especially, I like to introduce task force we are undertaking, focusing on Africa. Well, it's not just Africa what we do, the Asia section we have as well. So as Asian task force, with regard to Africa, somebody else is going to talk about Africa later. So let me touch upon Asia. This is a situation in Asia. So how they are doing diagnosis and treatments as well. And the Sysmex, they have automatic analyzation, malaria diagnostic system or devices. And then they actually use this in Southeast Asia. And the 5-ALA, this is supplement actually. And we think this is quite a good candidate to make drug or vaccination for malaria. And Dr. Kano is now working on this, and they are ready to start clinical study. In Laos, actually, clinical study has already started to test asymptomatic patients. So we are going to see how effective this 5-ALA is going to be on those patients. The data is taken, and data has been being analyzed at the moment. So this is achievement, and achievement made in Asian nations, but we now have to expand this attempt to African nations as well. So in Kenya, we can use same drug in Kenya as well. So having said that, they have had many discussions at the consortium, especially Asia and Africa. We are talking about Africa today, but it incorporates Asia as well. So the 3-arrow approach, as I mentioned, that's our strategy. And pandemic, and what we do after post-pandemic, we would have to build multi-resistance nations.
その with なのかですね、ここも議論のところですけども、
Post-COVID or with COVID,
問題点というのは薬剤耐性
the issue we have to tackle is
そして
drug resistance.
19とどのように共存なのか、
And other things like coexist, how we can live with COVID.
そしてその平時の時ですね、平時の備えが大事なことがよくわかります。
Also, we have to increase our preparedness to achieve UHC,
そして最後
including risk management.
皆さんの中で超過発明その動きが広がってきています。いわゆる脱植民
Also, other things, this is expanding idea, I think decolonization, that's another one.
でそれにはどうしたらいいか
So what to do? What's the approach for us?
というソリューション、そして
New solution
発活動
and to improve awareness
方々までに届ける必要が
so that we have further outreach to reach out to the people in the community.
社会システムの構築
And social system need to be built, including infrastructure.
ということが非常に大事なポイントと
So that's also crucial.
このような活動からですね、
So from those activities
保健
and undertaking,
されています。
we are finding effects.
しました抗マラリア剤として開発中の
So this is a anti-malaria drug 5-ALA.
新型コロナウイルスを完全に増殖を阻害します。
This can prevent coronavirus as well as malaria virus.
すでに特定臨床研究が終わっております。
In the test tube only though.
後遺症に関してはポジティブなデータ
And as for we have positive data.
からですね、それこそパンデミックがこのように起こった新型コロナに対するですね、そういうその効果を示すような
So this can be our new weapon to fight against COVID-19 as well.
でございます。すいません。
Professor, do apologize. Your time is up.
話がありますが、
Okay, let me just show this
接していきたいのがですね、
some information. This is important.
さんから言っていただいてもいいんですが、
Thomas, you can tell them.
でですね、
From 15 to 16 November, we have Nikkei FT conference is going to be held.
ご参加いただければ
Please join us.
以上、ご清聴ありがとう
That's all. Thank you. Thank you for your
ありがとうござい
attention.
ます北先生。
Thank you.
はい、それではですね、ここで
Okay.
外務省国際保健政策
We'd like to hear from the Minister of Foreign Affairs, Global Health Policy Office Manager, Mr. Ezoe Satoshi, who will talk about the Japan's plan for UHC in the world. Are you ready? Yes.
スライドを共有いただけますでしょうか。
So can you share the slides?
見えます。
Yes, it's there.
見られます。ありがとうございます。
Okay. Thank you so much. I'm from Ministry of Foreign Affairs. My name is Ezoe. Thank you very much for such a great opportunity. And at the beginning, Nagasaki University's Mr. Kohno and House of Councillors member, Mr. Akino, gave us really powerful messages, which I appreciate. And from my side, I want to talk about the Ministry of Foreign Affairs, UHC's trend. I will be really brief for 5 minutes speech. The slides are quite lengthy, but for more details, you can check them later. So I'll be really brief to talk about the UHCs and NTDs recent trend. So this June, the Japanese government talked about the global health strategy that was established. Previously, in 2015, the strategy was already created, but with the COVID-19 happening, the situation has changed dramatically. So as a government, we re-established this one. I will not go into details, but the policy goals includes 2 parts. These are the 2 major policy goals. First one is to talk about what's called PPR, global architecture, meaning prevention, preparedness, and response, to which we need to create an architecture to contribute. That's the first point. And second point is about UHC. It needs to be more resilient and equitable and sustainable as UHC. So these are the two policy goals. Of course, NTDs are included. In order to achieve UHC, no one should be left behind. So NTDs are included as well as other infectious diseases that we need to address. Next page, please. This is a continuation from the previous slide, so please take a look at it. NTDs are definitely included in this slide here. Next page, please. UHC's basics are shown here. Originally, international stage started to discuss WHC in 2005 World Health Assembly resolution. So since then, more definite discussions started. So looking at this cubicle, what are the definitions of UHC? There are three things. One is the proportion of the population to be covered. Two is a range of services to be made available. Number three is a proportion of the total cost to be made. So regarding NTDs, of course, these 3 points do apply. Next page, please. As Mr. Kita mentioned about what we should do for 2030, SDGs do include UHC. So NTDs are also included in here. Next page, please. The other day, TICAD 8, in terms of the public health, was held. For more details, please take a look at this. But regarding NTDs, I have highlighted this portion, which is about the contribution to a global fund. Regarding NTDs, GHIT should receive more contribution, it says. There is no pledge on the contribution yet, but as Japanese government, there is an intention to work on NTDs more solidly for Africa, especially through GHIT fund for the next 5 years. Further contribution should be made, it says. Next page, please. Please take a look at this later. This is about the outcomes of TICAD 8. Next page. So from here, let me talk about the recent trend at the United Nations General Assembly last week. So I will give brief comments to each one of them. This is about Global Fund Replenishment Conference, where Mr. Kishida, Prime Minister of Japan, joined, and $1.08 billion was pledged. This is a 30% increase. AIDS, tuberculosis, and malaria are the 3 infectious diseases, but for this contribution, overall health system needs to be contributed and addressed, which is an important point. And that's also part of the contribution. Of course, health system needs to be reinforced, which of course works for NTDs as well. So that's a wider perspective for the Global Fund to have more contribution. Next page. Regarding UHC, Mr. Hayashi, the Minister of Foreign Affairs, has co-hosted UHC-related conference, and a high-level summit meeting is going to be held next year. So G7 will be held, and together with this, UHC should also be promoted, and that is the resolution made at that meeting. During the United Nations General Assembly, Mr. Bill Gates visited Mr. Kishida to have a conversation, and GHIT was also mentioned by Mr. Kishida, so that UHC can be more collaboratively works on. Next page. Regarding the Kigali Declaration, which will be discussed later, from our ministry, Mr. Miyake from our ministry has made a signature to show a commitment as Japanese government. Next is the last slide. This talks about the global health and major milestones. You have already seen some of them having finished. The major events for next year are the following. 2023 G7 summit will be held in Hiroshima, and in Nagasaki, the ministers, health ministers meeting will be held. As Japan, we need to make more contributions to the global health, and we need to lead the global discussion on this. UHC and global health architecture are the themes to be discussed. Including NTDs, we want to work with other ministries to create something more solid. Regarding UHC, in September, high-level meeting will be held. We want to create a huge momentum for that moment. And towards 2030, SDGs will have its target year, and NTDs are included in the SDGs. So we would like to achieve UHC in its entirety. So 2023 is going to be a very important year for that. We appreciate your guidance and cooperation. That's all from me. Thank you so much. Thank you very much, Mr. Ezoe. Next, from Osaka Metropolitan University, we have Mr. Kaneko Akira, professor, to talk about integrated community-directed strategy for sustainable freedom from malaria in Kenya. He will be talking through a video. Yes, I'm from Osaka Metropolitan University. My name is Kaneko. Let me talk about an integrated community-directed strategy for sustainable freedom in Kenya. SDG has a global malaria spread, and Africa is one of the biggest challenges, and COVID-19 has created new dynamics. We need to work with the communities there in Africa, and social, economic, and biological perspectives are needed in order to understand the malaria mechanism, so we can understand the social conditions for malaria control. That's the ultimate goal. According to WHO, 2020's malaria cases and deaths compared to 2019 increased 69,000. And 2/3 of those additional deaths were linked to disruptions in the provision of malaria prevention, diagnosis, and treatment during the pandemic. On the other hand, it says here, what if the world had tackled malaria with the energy now dedicated to the coronavirus? We would have been in a totally different world, people discussed. Under the COVID-19, we can go beyond that and accelerate malaria elimination in tropical Africa. That's what we need to do. In the tropical Africa, still we have a malaria belt. And Victoria Lake Victoria, and Kenya's Koma Bay area is our area of research. Here, the mortality rate under 5 is high, and malaria is the major reason for that. And in here, the diagnostic treatment and intermittent prophylactic treatment for pregnant women have been addressed and scaled up for the past 20 years. But still, why do we have high malaria transmission that's continuing? That's the question we're asking. In 2012, we started the survey in community-driven activities, and then we found 3 problems. First one is the asymptomatic and submicroscopic cases that were found. Regarding these cases or patients, they do not get the treatment. and they cannot be found after inspection, but they still spread. The second problem is that they are pyrethroid resistant and early biting and exophasic vectors are happening. This is a huge threat. And third one is about multi-purpose human behaviors. People there use bed nets for different purposes. And there are delayed diagnosis and treatments in many cases, and there is a lack of ownership of the program. Who takes care of it? So new approaches are required. That's our thinking. So SATREPS is what we have started. Now, malaria infections or iceberg has been seen. If you have a fever and have symptoms before death, that's just a tip of the iceberg. Below that, there are a lot of asymptomatic cases, and that's decided by the age-reliant acquired immunity. Through collected treatment, we need to attack on a massive scale, and long-term sustainable approach is needed so that we can early detect and take actions against new cases. And we need to have an intervention that can change people's behavior. Thanks to this, we can have a sustainable malaria elimination in a collective way. And that's what we want to develop. The key here is a community health volunteers or community or commitment. Community health volunteer is so important. Before this started, we did a pilot study on the Lake Victoria island called Ogodenia. And this is a community-directed approach. And in this MDA, ACT and a single low-dose primaquine was used. They are used for the spread of malaria, and then they stop the electron wave. It used to be used 0.075, but we're using it down to 0.15. So we can reduce some of the other damages and make it effective by doing this change. Compared to PCR and a microscope, this shows about the infectious rate. And with PCR, we still have some infection remaining. Submicroscopic infection started to go up, and microscopic infection started to go up. This study shows that more sustainable and long-term countermeasures need to be combined. That's a very important lesson for us. And drugs safety and efficacy are at the same time important. Resurgence parasite characterizations need to be identified. And asymptomatic and a low concentration infection that are still spread because they are maintained. These are the challenges for the study. So in the Homa Bay Hospital, we established a laboratory for study purposes. This is a field sample processing center. And Sysmex XN31 was evaluated by us. So XN31 evaluation can tell us that it can be applied to field use. We can get a good fingertip sampling from malaria suspected patients. So going forward, COVID countermeasures or methods can be applied to schools. Regarding a novel vector control, Olicet plus saline net is what we are validating. Regarding the saline net, is not a new thing, but Sumitomo Chemical developed this. It's called Olicet plus. It as PBO to counter pyrethroid-resistant mosquitoes. And it can be used interior like this in the picture. So school children have the highest infectious rate. They can be protected with this saline net. And right now, cluster randomized control trial is going on in this district. And since last year to this year, the saline net has been used by the community and residents, and malaria's infection and occurrence and its efficacy have been monitored. This is about community engagement. Economists and we have been working on this. There are two pillars in here. First one is about economic intervention on the household levels. Another one is about community-based citizen science approach. Regarding this innovation, knowledge enhancement is important, and a certain incentive scheme is set up to see its efficacy. Regarding citizen science approach, we need to cultivate a social capital in the communities so that malaria's infection and occurrence can be measured. Economic innovation is the first item. Knowledge enhancement is important, and a tablet-based educational tool has been newly developed. Thanks to this, residents cannot see the asymptomatic infections or age-dependent herd immunity can be better educated. Next one is about incentivization for malaria prevention and early treatment and intervention. There are two ways to do this. One is about RDT's test, and if they're tested negative, then 200 shilling reward can be given. This is called conditional cash transfer. Another one is that when you are tested negative, then you will get a lottery, and 10% probability will mean that people will get 2,000 shilling as a reward. So these are the incentivization that we are trying to compare. And we have education, knowledge enhancement, and cluster and household level two-step randomization. That's the design we are working on. So from intervention for 5 to 6 months, and we'll do the RTD test after that so that we can decide the rewarding condition. And mobile money called M-Pesa is quite popular in Kenya, so that's what we're going to use. This person is the community health volunteer, and households she visits, and this is a developed educational tool to share knowledge. That's what she's doing. Everyone is watching it really seriously. And after that, the knowledge level is tested by the community health volunteers. This is the division of control and intervention groups using lottery, administered by the community health volunteers. So she is in the intervention group. She is happy. Another approach is a citizen science approach. In the community, social network needs to be first identified. And accordingly, we can find influencers in the community. And then these influencers can be the main characters, main players for sharing information and enhance knowledge within the community. By doing this, malaria infection or occurrence can be effectively controlled. Right now, we are thinking about novel control tools in different controlled areas for verification. But in the second half of the project, we want to integrate them to create a strategy so that we can create a concept study for the proof of the integrated strategy. In order to do this field work or field study of intervention, we need support. And Mount Kenya University has groups of researchers. Jise Gitaka is the counterpart for this study, and he's got students who got postdoctoral level students. They're young and they're really outstanding. That's what Mr. Jesse has. With their studies, the field to bench connection can be made. These laboratories hardware infrastructure can be set up going forward. Next is the frontline Mubita area. This is where Japanese young researchers are living in the community to work on a project. Their activity means that even under the COVID-19, this SASROOP's project can be studied and scaled up thanks to their support. So this December, Kenya's Kisumu will hold Africa Symposium. So this Africa Symposium will discuss the post-pandemic challenges and acceleration of the malaria elimination in tropical Africa. That's the theme of the symposium. And Lake Victoria's areas, including Kenya, Uganda, South Sudan, Congo Republic, Tanzania, Burundi, and Rwanda, are the countries that have shared challenges, which we would like to discuss.
はい、金子先生、どうもありがとうございました。
So Kaneko, now we had Mr. Hiruta from Sysmex to talk about the collaboration to combat malaria, titled Inter-Industrial Collaboration Aiming to Innovate Malaria Diagnosis Testing. So he's talking through the video. Hello, this is Hiruta, Yoshihide International Project Corporation. Thank you. I'm honored to have the opportunity to present this. And first of all, I'd like to show you the overview of the company.
Sysmex is a global in vitro diagnostics company holding the #1 market share position in the fields of hematology, hemostasis, and urine sediment analysis, providing products and services to more than 190 countries. We have an extensive sales and support network across the African continent. As part of our contribution towards the overall improvement of healthcare in Africa, Sysmex has joined the fight against malaria, utilizing our wealth of experience to develop innovative technologies, such as the XN31 automated hematology analyzer. Professor Kozo will now share with us her experience and insights.
The automated detection of malaria by the XN31 is based on a very elegant and simple principle. Parasites inside the red blood cells are labeled with a fluorescent dye, and the signal that is emitted is quantified, providing an accurate parasite count in the blood sample. This opens up numerous exciting possibilities, 6 of which I will highlight. Firstly, the XN31 can be used in diagnosis, since it is an objective measurement with excellent sensitivity compared to microscopy, and importantly, provides a simultaneous complete blood count. These features allow the treatment of the patient to be monitored. Blood transfusion centers provide another promising setting for the XN31, since the automated high-throughput analysis and detection of all 5 species of malaria parasites can improve blood safety and assess donor health. These data may also be used for real-time surveillance, providing information on asymptomatic donors who harbor parasites, including infectious gametocytes that can be transmitted to the mosquito vector to continue the life cycle. Because the XN31 can accurately count parasite-infected cells, this can be used to assess parasite clearance and may facilitate the early detection of drug resistance. Finally, it may serve as an innovative research tool in drug and vaccine development.
次にガーナにおける母子保健と栄養改善を目指す
Now, we like to show you the project
NGO 味の素
NGO by NGO NGO, NEC, Sysmex, us, we got together under collaboration. This is a project we overtook. In Ghana, the biggest risk is malaria and malnutrition. This could be prevent the child to grow, and also the increased risk for malaria. Infection with malaria can endanger pregnant women and children. Therefore, a holistic approach required to solve all three problems at once. So this project we are introducing ICT tools and diagnosis tools so that pregnant women can have high quality healthcare service. Mother and child handbook application developed by NEC. Data can visualize healthcare worker, and a continuous follow-up can be provided, and the standardization of skills amongst HCP. Also to promote behavior change of mothers by providing supplements. Ajinomoto, enhancing awareness of child care knowledge amongst mom by providing nutritious supplements. Well, currently, malaria testing can be done using tools like these on screen. They take too long, and the result is not quite accurate, and depending on the skills of the operator. But this device, CBC, MIRBC, well, these can be measured simultaneously under qualitative measures. Ashanti province, we have 2 sites, 1 hospital, 1 healthcare center. We have introduced this device, and we provided training how to operate this machine, as well as how to interpret the test results. On 17th, 27, 2022, we had a kickoff meeting, and all these players joined together and worked on a success model and develop into other nations, not just Ghana. Thank you.
Hiruta 様、どうもありがとうございます。
Mr. Hiruta, thank you so much.
はい、それではですね、
Next,
NTD に、テーマを
let's discuss NTDs.
まずは、
First, as I mentioned, AMIC NTD subcommittee's head is Mr. Kenji Hirayama from Nagasaki University. He will talk about PPP for eliminating NTDs in Africa.
プロジェクトについてご講演いただきます。平山先生、どうぞよろしくお願いいた
So,
します。
Mr. Hirayama, could you go ahead?
ちょっと時間が押している感じ
Seems like we're running out of time.
短めでお願いいたします。
If you can make it a little shorter, that would be great.
はい、こんばんは。
Yes. Good evening, everyone. My name is Hirayama, the head of the NTD subcommittee. So let me talk about NTDs with 3 guest speakers. I will be the first speaker to talk about the NTD subcommittee's vision and the discussion outcomes and proposals coming out of such discussions. Finally, the conclusion, as shown here, is that we need to create a sustainable health system for NTD countermeasures. How can we create that ecosystem there?
NTD が20種類ある。
So 20 neglected tropical diseases do exist, and we have the parasitic diseases, we have fungi, bacteria, and viruses. They are endemic diseases. So 20 neglected tropical diseases, and what's in common is that there is a poverty, there is a discrimination-based issues. In order to resolve all that, public health initiatives are very important. And drug development requires international cooperation. That's indispensable. So these are the 3 factors that we have in common in these problems. So for Japan, since 19th centuries, we modernized ourselves and these diseases have been eradicated basically. But since 1990s, on a continuous basis, Japan's NTD countermeasures and their initiatives and leaderships are what Japan has to lead the world. So Japanese government and Japan's contribution has been not well understood domestic and abroad. Why? One reason is that the actions are not systematic or collective, as people discuss. And in 2018, JAG NTD was established in 2018, and Nagasaki University has a secretariat there. And this JAG NTD works not only domestically, but also internationally to unite combat NTDs. They communicate with other institutions and organizations as a window. And this year, in order to deepen people's understanding, as mentioned already, NECCAN, or the consortium of the Institute of Tropical Medicine Studies, have been worked upon by them. At the NTD subcommittee, we have set forth the short-term goal, which is to list up what Japanese people need to do, and we're going to send that as a message to the wider world. In this side event, there are already 200 people registering to this event. So the message to be created by all these stakeholders needs to be something that cannot be ignored by all the stakeholders. And the evidence for that is that by 2030, the long-term vision or goal or roadmap is created by WHO, and Kigali Declaration on NTDs also clearly defines the goals in this regard, based on which Japan's short-term challenges or policy making or initiatives should be created more. That's what we can do. So the first thing we worked on was the Kigali Declaration, and Japanese government can make proposals related to that by getting proposals from relevant organizations. That's the first outcome. In 2015, May, NTD's eradication of the Congressman Alliance created and submitted this proposal here. In this Kigali summit itself was postponed, and this was held this February and adopted and signed. This is a very important commitment included in this declaration. Inside of that are the items here. Expanding investment in GHIT fund is one thing. Next one is increasing NTD projects using official development and assistance. Number 3 is about ESPEN. Expand funding to influence on ESPEN. An NTD program of the WHO Africa Regional Office. And number 4 is about leading the move towards the establishment of a global fund for NTDs. Number 5 is increasing support for civil society organizations involved in NTDs control. That's the proposal we made. And 2 subcommittee meetings were held to brush it up. There were a lot of discussions, among which we discussed that those great medicines have not been accessed and provided to the people who need it. That's the challenge. That's a challenge faced by companies and other stakeholders. For example, Plazcanto, mycetoma, drugs, Chagas, disease diagnostics kit are all great medicines, but they are not accessed and provided to the people in need. Those are the issues we are facing. So right now we're targeting next year, because G7 summit will be held next year in Japan. G7 agenda will talk about peace and diversity problem, and NTDs should be also taken up. So we're now creating the proposals for that. Let me talk about that. This is a proposal that was already drafted before. And at the beginning, it says the following: the G-HIT, Japan's government and Bill Gates and pharmaceutical companies, innovative R&D were quite well evaluated by these figures, but access issue needs to be taken up more actively. That's what it says here. When we think about access issues, the biggest issue is to deliver the medicine to the patients, but there is no global framework to work on that. Compared to other diseases, NTDs need to be sustainably provided so that in developing countries, they need to work in organizations and collaborate with each other, which is lacking. And NTD-related new organization should be created, or existing organizations should have more scope of work, or otherwise, existing organizations can collaborate more deeply. So that's the establishment of the global organizational framework to be created. Of course, if you look at the details on a global level, sustainable supply of medicines and regulatory approval is needed. And the most importantly, there are regional and national levels. These detailed countermeasures have to be taken as described here. They're important. So especially important but difficult is to have regional and national level health system or NTD programs to be reinforced. NTDs medicines need to be delivered to the patients without fail. So in order to do that, there are 4 things here. Ensuring NTDs medicines reach patients involved. 1, strengthening the capacity of primary healthcare and health insurance schemes. 2, laboratory networks to diagnose and treat NTDs. 3, the drug supply chain needs to be established. And number 4, pharmacovigilance systems and other health information systems need to be strengthened. These are the 4 challenges that needs to be resolved through policy making. And what kind of policies can we create through projects? And what are the systems we need? And that's the proposal we need to make next time. In this proposals, more than 20 stakeholders and companies have agreed on it. So let me just name them up here. Thank you very much for your time.
平山先生、どうもありがとうございま
Thank
した。
you, Dr. Hirayama.
それではですね、続きまして、
Now we are moving on to
NPO 法人クローバーヘルスインターナショナル
Global Health International Secretary Dr. Yotsu Rie. Her presentation is titled Digital Health Innovation for Skin NTD in Africa. Please.
本日はTICAD8のサイドイベントという非常に貴重な場に、
Thank you for giving us this opportunity to join this event.
私たちのイノベーション
Our innovation in developing country, we are develop digital health tool to be used in that area. I am Yotsu from Churen University. So this is a background why we are doing this. So we have been doing this global health and leprosy, bullying, scurvy. These are the special we are specializing in. And the project we are undertaking is skin surveillance work as well as digital health to development, as well as R&D for diagnostic kits and drugs. WHO is now promoting skin NTD integration, and the main focus is on this disease. In this June, and the framework has been integrated, and that was announced. So our work is introduced as a good practice in this scheme. not just NTD, but skin disease all over. We can treat and we can manage these diseases. So this is still one of those neglected diseases. WHO has 20 NTDs, and out of 9 skin disease. And over 1 billion people are suffering from this disease, NTDs, skin NTDs. On the other hand, skin disease in general, this is 18th leading cause of global DALY. And 4th leading cause of disability worldwide. So as you can see, so this is quite a high-risk disease in Africa. Especially this is widely prevalence in remote community in Africa. So far, we started the skin surveillance. On the left-hand side, this is quite simple surveillance. And starting from this, sometimes we send specialists to the area and provide support. However, this does not directly provide solution. So this is why we had to provide this device. So by doing this, we can using this system, we can reach wider audience to survey their skin, and the follow-up can be possible and enable diagnosis to support in case management as well. E-skin health appli. Let me talk about this. E is E means in Japanese good. So good skin health app actually. And the two main function, this is portable. And another thing is it could support remote treatments. So those appli normally takes internet, but this one can use offline. So offline function is there. Also, this device allows documentation on patients' clinical course over the time. You can take clinical image in chronological order. Now this one shows the screen from the app. So this is when diagnosed and how many days elapsed. And after 2 weeks of treatment, this is an improvement shown on the down below. Even if you take sample, if the patients are living remote area, it's harder to provide feedback from the patients for the patients. But by using this system, this app, we can give the patient timely feedback. That's infrastructure we needed. This is a core member of the development team. Apart from me, other 7 people involved. So science, Dr. Ito and NPO International member from that NPO International joined. So this is how we work, always communicating. That's how we develop this app. And those people who are not shown here, we receive support from them as well. So the app was created based on the massive support. And also we received funding from those organizations. Thank you. So the benefit, what's the benefit? Of course, we can improve the care for the patients. Also, empower healthcare providers like HCP. Also, we somehow managed to educate other people to get better understanding of skin NTD epidemiology. So one of the projects, let me introduce. This is west of Koto d'Ivoire. And from far away from capital, you can see. The objective of the project is to integrate surveillance approach plus for early detection and started in 2019 January, and it will soon to be ended. So this is preliminary result that I am showing. eSkin Health. At the moment, 107 cases are now registered in eSkin. And the scrubby, that's the top number of disease that patients get in touch, contracted, 92%. And by 2022, the number is going up. But due to COVID, 2020, 2021, we are quite idle, couldn't do anything. So this is like before and after. So you can see the impact, clear impact compared to 2019 and 2022. And something I have to say here is mycetoma and other disease. This was quite newly found disease. By using eSkin Health, we were able to find or diagnose these hidden symptoms in this area as well. So how they are, how users are responding to this new app. So this is system usability score I am showing here. And most of the people find it quite useful, more than 80 people. So that's the score is over 80, quite good. So in 2022, compared to 2021 December, improved. That's the result. We also do empowerment for HCP. We interview them and we ask them how they are doing with this new app. Before the project, they only could say, well, that was a skin disease, but now they know what's wrong with the skin exactly, and then they go through the training. They can write the good diagnosis. That's the change. So he is called Mr. Bear, and in his area, he is a dermatologist. Dr. Bear, that's his name, and he is quite pleased with the outcome. This one, this is a leprosy child diagnosed with leprosy, but then she is completely cured leprosy. So because of the early diagnosis and early treatment, she looks quite happy, doesn't she? So skin NTD, how important it is to find out earlier and start treatment earlier. The Japan and Cote d'Ivoire collaboration, this is one of the success story. And against background, so we can think of these four elements, because communication was open. And eSkin Health, we listen to the feedback from the actual local, and then we took the information and to enhance the app and providing with a tool. Tool is important. We have to give them tool and building ownership to build sustainability. So this project implementation at the site, we always have somebody to manage and look after them. And we struggle at the beginning, however, well, because project team took the ownership. So that's what led them to the success. So I can do remote monitoring or surveillance. So e-skin health, this is the adequate tool for the time with COVID. And now for the future plans, we have national database, and we wish to align this new system with align with the new national data, so that country can have ownership and sustainability. And then how sustainable this system can be, we have to think about it. And then we are targeting the developing nations. So Global Health International, they are NPO. That's how we established this NPO. And those who are interested in our project from other nations, Ghana, Tanzania, they are quite keen to join us. And we need to build more evidence. And we have many data in the system, and then we need to decide what to do with those new data. Then take it from there, try to aim new innovation, further new innovation. This is reference. These are the link for Global Health. If you are interested, please click one of these. So these two we developed. It's not just a skin NTD, but skin disease all over that can appreciate this app. So universal health coverage, we can support this scheme through these devices or app. So that's how we are moving forward. And thank you beforehand for your support, continuous support. That closes my remarks. Thank you. Close my presentation. Thank you.
Thank you very much, Ms. Yotsu. Now, this is the last presentation about NTD. So from Association for Aid and Relief Japan, AAR Japan, we'll have Yoshie Osawa. She will talk about systems for access to mycetoma diagnosis and treatment. Please go ahead. Yes, hello everyone. I'm from AAR Japan. My name is Osawa. Let me share my screen. There is a boy with mycetoma. He came for treatment. That's the picture you are seeing. In 2013, we started working on mycetoma in Sudan. That's got a lot of mycetoma. So from the skin, the fungi or bacteria that starts to proliferate, and they eat up the muscles, and it's troublesome because you don't feel the pain when it's progressing, and when you notice it, it's so serious, and when it's so serious, you have to amputate. That's what this infectious disease is. So in order to support them, what are the challenges we are facing? There are many challenges we're facing, and in rural areas, the healthcare is not enough, and in these areas, there are traditional healers, as you can see in the illustration here. So sometimes the fruit of a tree can be used for the area, but they are actually low effectiveness. So effective diagnosis and treatment is delayed. And mycetoma is not that known yet in this country, so sometimes people leave it unattended. And mycetomas patients and their lives have not been investigated well. So this is one of the NTDs. So publicly or privately, support is needed more for mycetoma. So what can we do? At AAR Japan, we have started 3 activities. First one is about medical support. In Khartoum, the capital, mycetoma Research Institute is located, and the doctors are dispatched to rural areas so they can do the diagnosis and treatment. And if needed, they also do the amputation. Those are the supports we have done. And awareness raising is very important. So we started to visit individually or under the trees or in schools. We started to do enlightenment activities so that they know that they have to see a doctor if you spot skin lumps, even if they do not cause any pain. So that's the knowledge enhancement we're doing to spread. So regarding the patients, we need to know them better. So patients and their families and their lifestyles need to be understood much better through a field research. So far, Khartoum to the south, White Nile, and the Sennar states are the areas we're working on. And this year, Jazeera state, 5 or 6 hours from the state capital, are the areas we're working on. So through these 3 activities, is it enough? No. For example, as you can see in this photo, this is a man who's got a serious mycetoma, and amputation was conducted to him, and then he could not get an artificial leg, so he just collected whatever is around him to create an artificial leg so he can manage to walk. So this means that we need to comprehensively support the patients. And what can we do in order to do that? So from this year, we're now having 5 focus points rather than 3. So far, it was about dispatching doctors or knowledge enhancement or early detection and early treatment. Those were the first pillar. Second one is about the assistance to patients under treatment. It's about understanding the patients better. How can we support them psychologically? Because the treatment is not one-off activity, so their transportation and accommodation needs to be assisted as well. And when they are serious in symptom, sometimes they have to amputate. But then how can we support their prosthesis support? And that's about 3 and 4. And number 5 is about having more friends or people or colleagues who can work on the advocacy and capacity building activities. Or local NGOs can be trained to build up their capacity so that they can support the mycetoma patients by themselves. Those are the purposes or activities that we are doing. I think I spoke a little too fast, but that's it for my presentation about our activities. Thank you so much. Okay, thank you so much.
時間が押してまいりましたが、
Now we are working a little bit behind, but let's just move on to phase 2. So we have panelist Mr. Hinoshita from government and G-Hit Fund, CEO Mr. Kuni, and from Ezoe, we have Takayuki Hira. And addition to that, Professor Kita, Professor Hirayama from Nagasaki University, facilitator is played by Mr. Inoue from G-Hit Fund. So I'm going to give microphone to Imoto-san, Mr. Imoto. Thank you. Thank you for the kind introduction. I am Imoto. Nice to meet you. Oh, we only have short time, So we like to skip the introduction and then straight to the discussion. So in Africa, we have been seeing the cases like how you are combating malaria in Africa. So here, we like to talk about, based on the presentation we have received, so NTD, especially focusing on access for the treatment on the healthcare. So first of all, Professor Kita, you talked about the containment of malaria, and we know your achievements. And to make the reach wider. And what's the most important things to do that, to make that achievement? What was in your experience, what was the most important things to remember? Hello. Well, that's what I said. Can you hear me? Yeah, that's what I said. What's most important is, well, I see too much gap between infrastructure. Well, in some area, you are thinking ready for make digital transformation, but in another area, you can just, be swiped off by the flood or something. So the drone, to talk about drone, now drone is being used in the more effective way. So we would have to find what's best for the region. There is a critical gap between regions. So we have to select the tool to support them wisely. The Global Fund, Kuni-san. Listen to Kuni-san, because he has wide experience in that area. Thank you. Thanks. Okay, so I would like to ask Kuni-san from GHIT Fund. You have many knowledge, and as theme of this event says healthcare access for especially the endemic area for NTDs. So from your experience, what can you say? What can you tell us? Thank you. Well, back in old days, in the rural area, it was quite hard to access. So I have experience being to Somalia, and there's even no pavement. And sometimes when it rained hard, it was just lead to flood. And in mountain area, you cannot go in by the car. And you just have to physically carry the vaccination box. But these days, deep fog, well, they don't have anything. So some people who has been to overseas, they just start up a company, and many people have smartphone. So the things you have imagined, that is not it. Probably in terms of DX, maybe they are ahead of Japan. Maybe we are left behind. That's a possibility. The speed is immensely. So like he said, open source, anything, and then build something, and then we get feedback. And some Japanese startup companies, they use startup, and they send in electricity to the healthcare center. That's one of the business they're doing. So that's one of the cases. So in that way, we don't have to think big, small, think small, and build infrastructure, just to do it, and then start something, anything innovative as well. Then introduce app or increase the number of app. Well, health information system was introduced, and it's been expanded into more than 70 nations in the globe. So we just have to be positive and aggressive as well. Thank you. So we don't have to think the lack of infrastructure a challenge. Understand? Thank you. Now I am moving on to Hida-san from Ezoe. We have been to Sudan together, right? Before, I said for the to visit mycetoma endemic area, and not just Africa, but your companies are fighting against NTDs as a company, especially in terms of access. Private company, as a private company, I think you are quite important position. So in terms of standpoint of company, what's the important things to think about? Well, thank you for giving us this opportunity to join. Access. I don't know what comes up to your mind when you hear access. So one is probably, I think we tend to focus on how to deliver the goods. Of course, it's important. However, filaria and the mycetoma we've been talking about. So let's take these two as a comparison. Filaria, before 2000, WHO had a program to control this disease, and all the drugs were provided for free. However, and the resource NGO, they are doing carrier. And then most important thing is to give it to those who need it. And 20 years went by, they have a new roadmap. And then it's connected, I think. So we have more than 20 billion tablets for 8 African nations, and we give them for free. That what we have to do, our role is to deliver to the storage of the governments, and from there, that's their responsibility, and to give the medicine actually to be swallowed by the patients. And the ownership priority, it has to be sorted out. And on the other hand, mycetoma, G-HIT fund. The G-HIT fund is promoting the R&D activities as well. That's my understanding. And the Japanese companies are joining in the fourth. And overseas academia or overseas corporation, they are working together with Japanese company. And this WHO guideline, they, including, we would have to think about the access for the nations where WHO guideline does not apply. So for instance, Sudan, rural area, Sudan, there's no medical support, and still there are patients. So if we have done clinical study, then the most important question to ask is how we deliver. And there's no standard way. So because we have G-HIT, and then we can think about how. So that's we talk about, we pharmaceutical companies sometimes get together and talk about. And well, let's say we have found new drug, and then clinical study done, and we have to speak to the legislator, and then we have approval. But how can we make these drugs accepted by the globe? We didn't know, but now we do. It used to be for free, but donation model, free model, it's not going to be sustainable. Too many actors in there, and then of course somebody has to foot the bill. So we can sort of licensing, and somebody who is good at producing the drugs, we can give it to the license. And or to the government or to WHO, we have to ask to set up the clear guideline how to those drugs to be used. So I think this is one of those access issue, the new access issue. We have been talking about old access issue, but now I like to emphasize there are new access issue. How we can deliver. Your comments are going beyond of that comment. Thank you. Also, you also mentioned about the R&D elements. Thank you. We can go on like this, but now NTDs. Dr. Hirayama, you mentioned something. You are the chairman of JAG NTD and other group that are involved in NTDs, but we will have to talk about G7 now due to the time restraint. So we are receiving many information with regard to G7 summit next year. So for Japanese government, in terms of healthcare access, what are the expectations? How do you feel?
いろんな、特にアクセスという問題で一番大事。
Well, in terms of access, the important player are companies, corporations. So global framework can apply to some elements, but you might have to go directly to the local area to avoid some issues. So there could be legal issue and how we can remove those barriers. And most biggest issue is finance. This is for anyone. And how much money we can spend, and can it be justified? So you have to work on the guideline, or standardization might be needed. So those talk has been done within NGOs. And some people are protesting that why we have to do the things that it's not profitable. And we need to talk about the economy, medical economy in a wider area, wider sense. By doing so, we have to build the framework, clear framework. And it cannot be done by one person, but we would have to get united and then working to the government. I heard this conference held in Nagasaki, so that's a good opportunity for us to advocate. Thank you.
Thank you so much. I think, in a nutshell, I think as a Japanese government, if we can talk about one single thing, what we have to do, that would be easier. But it seems like it's really wide-ranging and comprehensive challenges that we heard. So lastly, but not least, I would like to hear from Mr. Hinoshita. G7 summit will be held in next year in Hiroshima, as well as the health minister meeting will be held, and malaria, NTDs control and access may be a direct agenda, but this may prove difficult. So as we talked about the UHC and importance of the regional areas, and in Africa, GHIT could be the one we can work through Japanese government to really contribute to NTDs, as well as GHIT can be a good contributor. So global framework is what we are lacking, right? So from G7 context, in order for us to discuss in a more effective way, what kind of things can we do within the agenda setting in Japanese government? What can you tell us? If you can mention some of those points I covered, that would be great. Can you hear me okay? Yes, we can. I think, as Imoto-san mentioned, G7 and ministers of health, as well as Hiroshima summit, are being discussed in terms of what we are going to really discuss as agenda. And we have the emergency group for within our ministry. And what kind of agenda should we set? We have just started discussing that. Within G7, international health has challenges, of course, and historically, there is a continuity issue. So what to take up can be decided to a certain extent. So looking at the current trend, for example, COVID-19 could be one pandemic topic that we can discuss. I think that could be one of the biggest topics. And then how do we address that? And then looking at this COVID-19, as well as the future pandemic, can we really eradicate that or control that? What are the roles of the advanced nations? Because they have a huge economic impact to the world. So we need to really take solid steps. I think that's my passion comes from. And we tend to focus on that. But that's one thing. But on the other hand, as long as we talk internally, universal health coverage is the agenda for Japan, at least. We need to include UHC in Japan's agenda here. That's how we're discussing right now. And as Japanese government, well, NTDs need to be worked on by GHIT Fund, which was established, really thankfully. We need to activate their activities through discussion. I think we need to do that. As mentioned by Mr. Ezoe from Ministry of Foreign Affairs, NTDs and Global Fund were also mentioned, and AIDS, tuberculosis, and malaria will also be touched upon, I believe. Under the COVID-19, what kind of discussion should we have with what kind of pillars or systematic understanding? So that's one thing, but another pillar is innovation. As I said already, there are two pillars, but in what way should we address all of these? We haven't decided yet, but I think those are the frameworks that we can think about. As mentioned already, innovation is something that has a lot of possibility, potential. For our future, when we promote universal health coverage in developing countries, we need to give support, but conventional ways require a lot of money and time. But with this new technological innovation, we can change the environment so dramatically. So that's what we need to promote. We need to make the best use of such technologies. One of the tools is a GHIT Fund, I think, or we also have other tools at hand. From that viewpoint, I think that, for example, AIDS, tuberculosis, and malaria were mentioned. And with malaria, we can create a new framework to really spread initiatives. And Global Fund is important, but before that, we have Unit Aid, through which we can spread people's activities, and ultimately, Global Fund, as a massive amount of fund, can be utilized for the better. In any case, existing organizations and existing frameworks can be utilized to make sure that it's effectively spread. That's what we have to think. But regarding the things that we do not have right now, we talked about NTDs already. How do we work on those things that we don't have the solutions for? But how much can we reflect our agenda into this discussion? We have only limited time and resource. So how much we can discuss is still unclear. But including NTDs, if we don't have the diagnosis or treatment, then how do we make the vaccination or diagnostics or medicines to create access to patients? I think 2,000 years in 2000, Okinawa summit was held, and since that time, this has been a challenge. So we have to discuss in whatever way possible. That's all from me. Thank you. Okay, thank you so much. You talked about pandemic, but maybe all the topics, but you also mentioned that UHC needs to be addressed. That's a really relieving comment. And you also talked about GHIT, so thank you so much. Okay, Mr. Kuni, you're raising your hand. Sorry, yes, I just wanted to say one thing. Thank you so much for mentioning GHIT Fund, by the way. Today, we heard a lot of information, and what I feel that how do we accelerate all these initiatives? I think that's a very critical point. R&D is important, but in the end, how do we, as he mentioned, how do we accelerate the access and delivery so that we can save people's lives and contain the infection? That's the everything. How do we make it accelerated end to end? As far as I have heard today, for example, by 2025, there are some initiatives mentioned by Mr. Kita, but we have to accelerate that. How can we make it faster in terms of deliverables? And that's $1.08 billion, right? So that's the amount of money that Japan should invest. Otherwise, other countries may be using, of course, ZHIT can use it in the end, but I mean, Mr. Hinoshita is also having a lot of tough problems, but we need to create Japanese products, and on-site Japanese NGOs and other organizations can be involved so that they can use our money, because we have money. Throughout the world, we do have money. So please use that. Another point is that, as Ms. Yotsu mentioned, there are a lot of devices being developed within, not only in Japan, but also in overseas or foreign countries. There are consultation firms or NGOs that can buy the Japanese products and spread those products. How do we scale that up rather than just doing the pilot studies? So what we have to do is that, of course, R&D is important, but how do we make an impact in the end? And what kind of backcasting should we do in order to understand the current status so that we can accelerate the initiatives? Because it's about partnership. We have TICAD, UNITAID, and many other partnerships are available. So rather than all Japan, we need to say with Japan, including Japan, we need to sell our products to foreign countries. That's what we think we need to do. So acceleration, that's a keyword. Let's think about this together with all of us. And thank you for mentioning GHIT Fund, by the way. Yes, thank you so much. Mr. Kuni's passion has summarized the time and the panel discussion. So I would like to conclude this panel discussion. Thank you very much for everybody's comment. Okay, thank you so much. We could spend hours and hours discussing this. I have felt a lot of passion in that. Maybe we can hold a next round of session sometime in the future. Or Mr. Kita or Mr. Hirayama, if you could give us a closing remark, that would be great. Yes, Kita speaking, first of all. Or maybe Mr. Hirayama, could you go first? Yes, it was a very heated discussion. Thank you so much. We want to summarize the discussion outcomes so that we can make a next round of proposal, because we talked about acceleration. So we need to reflect that acceleration piece into the proposal. So I just wanted to say thank you so much. So Mr. Kita? Yes, Kita speaking. So many people joined this event and we're running overtime, but most of them are still here until the end. I appreciate that. And at the panel discussion, I think I thought that it would be in 10 minutes, it would be ended, but seems like we have gotten a lot of good suggestions. And as Mr. Kuni said, we need to speed up. We want to really speed up, but we cannot do this. But if you say it so clearly, we need to do this, right? And as you listen to this, you also agree that we need to accelerate. And I think this is where we can see the synergy effect. So in this side event, I was thinking what to do with this side event. And it was a great thing that we did. We held this side event, and this should be the cornerstone for the next step. And together with the participants here, I'd like to make it better. as people say, all Japan, it's more about with Japan. We need to contribute from Japan to the world. And substantially, we can create that system as a structure. So we appreciate your cooperation and understanding. So once again, thank you so much. Okay, Mr. Kita, Mr. Hirayama, thank you very much. So with that, TICAD's 8-side event, we'd like to close the event, NTDs and malaria control in the area of with Corona, the building of a healthcare infrastructure. So thank you so much for watching us until the end of the event. Thank you very much.
ありがとうございました。